Assalamualaikum and a very good day, everyone. So, welcome to chapter 5, in which we will learn writing medical certificate, or more commonly known as MC. Again, I would like to remind everyone the aim of the MOOC. Basically, we want you to understand the principles of good documentation. You should be able to be identify the errors, the common errors especially, and perform the basic documentation in clinical practice. Right. So what is medical certificate is actually a document that from a doctor given to an employer or a school principal to certify that this person is injured or not well, okay, and they are not fit to be in the working environment or at school, right? So why do we give MC is actually to promote the patient to be to make sure their recovery is faster, and of course we want to protect others from the harm lah. Especially when the patient has an infectious disease like COVID, for example, so you can actually prevent harm to others. All right. Okay, your MC can actually helps the patient to recover a lot. Yeah. All right. Occasionally you will see patients who just really need an MC, okay, just to recover. They do not need any medication, they just need an MC to recover, because what they need is essentially rest. Okay, so the law on MC, there are three separate laws that you have to be aware. For a government servant, this is your general order. Okay, specifically it is stated that once you are certified by a doctor to given an MC by a doctor, you can take leave and your leave will be paid fully. Okay, so this is the law on the government sectors. For the private sectors, a working force in the private sectors is Employment Act. It is stated that you should be paid fully if a doctor has given you an MC. Okay, in the Medical Act 1971, it is stated who can give MC, which is doctors and also dentists, right? So there are many types of sick leave, which includes cuti quarantine, yeah, to take care of your children or to take care of yourself. We also have cuti TB, cuti kusta, and cuti bara. Okay, if you have TB, you are entitled to 12 months of fully paid leave. You have kusta or you have cancer, you are entitled to have 24 months of paid leave. Okay, but this is only applicable to government sectors. This is to allow the government servant to undergo treatment that is necessary, and sometimes this treatment is very long, okay, and can be taking a toll on their health, mentally and physically as well. The treatment itself is so big that the government have decided to give them paid leave for 24 months until they are fully recovered, right? So a lot of times people wonder how many days should we prescribe or give to the patient. It actually depends on your clinical judgment. It has to be case to case basis, and you have to see through practice. You open your clinical notes, you see how many days does doctors give to patient with fracture, for example. Okay, you have to be aware, sometimes long duration MCs needs to be reassessed. If you are giving MC for 3 days, usually it does not require reassessment. But for example, if you are giving for 1 month, yeah, maybe after 2 weeks you need to revise the MC. Okay, some patient does not require MC at all. You just need to give them time slips because it is sufficient, and you have to be informed that you cannot be forced to write an MC, okay, because this is your privilege and your duty not to abuse it, right? Okay, some patients are very demanding on getting an MC. Right, your MC is so powerful it can put a trial in court on hold. Okay, so you just make sure that you are prescribing MC to the appropriate reason. Okay, you do not want your MC to become controversial, such as this. All right, in the Malaysian Medical Good Practice Guideline 2019, it is stated that you must evaluate every request for MC with a good history and physical examination. You cannot simply give an MC based on request and you do not assess the patient. This is wrong. In fact, it is actually an offense under the law, especially particularly under SPRM, because when the patient was given an MC, the employer become less productive, they cannot make money, and on top of that they are losing money because their employee are being paid for free, okay, but while on leave. All right. So MMC has stated again, you must not issue medical certificate without examining the patient and without making clinical notes in the patient's record. You cannot see the patient and write MC without making any entry. Okay, that is an offense and you can be punished. Okay, MMC has written here again that you can be liable for disciplinary punishment. So let's learn how to write MC. If you can see in the background, this is the typical government MC. It doesn't have to be this color. If you are working in private, you can do whatever you want, but for government MC, this is the official color. Right, so let's have a look. It's fairly straightforward and easy to do, right? You just need to write the patient's name followed by their IC number, because people can have similar names but the IC will be different, so you have to be specific. Dari kementerian atau dari jabatan, you can put yang berkenaan, ataupun if you know the patient is working in specific department, you just write their departments. Okay, tidak sihat untuk menjalankan tugasnya sempurna selama 3 hari. For example, you have to write number 3 and then in bracket 3 hari, or in reverse lah, 3 hari in bracket number 3, hari daripada tarikh bermula hari ini sehingga hari apa. Okay, boleh bertugas semula pada tarikh apa. If you want to leave this blank, please put dash. Okay, beliau dikendaki datang semula untuk peperiksaan pada, if you do not use this column, put dash. Okay, your signature, your clinic hospital CHOP, your signature, and then your CHOP. Right? Okay, this is an example of complete MC. Patient's name followed by the IC. If the IC is not written, it's not valid. Okay, jabatan yang berkenaan, the number of the prescription 14 dalam kurungan 14 in writing. So this is to avoid doubt or alteration by the patients, starting date and ending dates. Yeah, if you leave a column blank, just put dash, and then beliau dikendaki datang semula untuk follow up pada tarikh follow up the patient lah, meaning that you are giving the MC until follow up the patient. Alright, the tarikh, the signature, the ward CHOP, and your CHOP. If you are in clinic, use the clinic CHOP. Okay, fairly straightforward. Okay, let's recap. So basically, just now you have learned the importance of MC. Yeah, basically is to allow the patient to recover and prevent others from getting sick from your infection. Right, you are now aware of the law behind MCs and the abuses. MC is so powerful, it can stop a court from hearing. Okay, those who are on leave must be paid by the employer. Okay, it is protected by law and only doctors can prescribe it. It's a privilege, that is the only profession that has the privilege to do to prescribe MC. The other profession is your dentist. Okay, we have learned also how to write an MC. Right? If you have any questions regarding this topic, please feel free to contact me. Thank you.